In a country where life never stops, imagine if, one day, it all just stopped. What would happen if the guardians of our health, the doctors, decided to lay down their stethoscopes for good? Hospitals, once filled with hope and healing, would become places of despair. Emergency rooms, surgery theaters, and clinics would fall eerily silent. The clock would start ticking, not just for the patients waiting for care, but for the entire nation. In just days, the consequences would ripple through society. Critical surgeries postponed, life-saving treatments missed, and chronic conditions left to worsen. Millions would turn to self-medication, superstition, or quacks, desperate for any relief. Frustration and fear would soon spill into the streets. Protests would erupt, demanding action from a government caught between the impossible choice of bowing to demands or watching the country fall apart. The fabric of society would begin to unravel. With no one to keep the workforce healthy, the economy would buckle under the pressure. Industries reliant on manual labor would grind to a halt, and the ripple effects would be felt across every sector. Factories closed, businesses shuttered, dreams abandoned. In rural India, the impact would be even more devastating. Entire villages could be wiped out by preventable diseases, turning once thriving communities into ghost towns. And the toll wouldn't just be counted in numbers, it would be felt in the heartbeats that never had a chance to grow, in the families torn apart, and in the loss of a future that was once so bright. A year into the strike, India would be a shadow of its former self, the healthcare system in ruins, the economy in freefall, and a society forever scarred. This is not just a health crisis, it's a national catastrophe. But it doesn't have to be this way. Doctors are the heartbeat of our nation. Their dedication keeps us all alive. Let's make sure we never take that for granted. Because without them, the future is uncertain.